Good morning. We are at the last day of the second jury round for the 10th Aegis Graham Bell Awards, and I have a very innovative SriHarsha. He leads the growth at DocsApp. Welcome, SriHarsha.
Thank you. Hi, I'm Harsha. I take care of growth at DocsApp. So DocsApp started in 2015. Satish Kannan and Abhishekar from IIT Madras were the founders of it. So Satish and Enba wanted to do something in healthcare from the beginning. Satish was after IIT. Satish went out to work at Philips Healthcare, and Enba worked at one more healthcare project in IIT Madras itself. So during their stint at Philips and IIT Madras, they found out that there are a lot of doctors in India, but not enough spread. As in, there are more specialist doctors in cities, and there are very few in tier 2, tier 3, and there are no doctors in villages at all. So they thought that a platform where people can talk to doctor at the comfort of their home without traveling and booking an appointment would help to a lot of people in India. So that's where DocsApp has started. So when I was one of the initial employees at DocsApp, so I joined when DocsApp was about to be started. So I joined as a developer initially. I did the initial part of coding and all for almost 1 year, and then I moved to growth. I was the first person in the growth team, and then now we have more than 10 million users. So the journey from the first user to 10 million users has been really a roller coaster ride, I would say. There have been a lot of learnings that we had. So we had to mold the product innovatively according to the customers and how they are receiving the online consultation concept, right? So as you know, Indians still believe in doctor touching them and talking to them and putting the torch in the mouth and to find out what problems that they are having. So online consultation won't have those things, but such studies have proven that more than 70% of the healthcare issues need not have a physical visit to the doctor. So that's where DocsApp comes into picture. So people come, ask their health question on DocsApp, pay the consultation fee, and then have conversation with the specialist doctor. So we have specialists ranging from general medicine to neurology, oncology, and all. Like we have across 20 departments, we have doctors, and people come across India from across different corners of India to talk to these doctors. Yeah.
Harsha, there must be many challenges and roadblocks that you must have faced during your journey. Yeah. So what were they, and how you overcome?
So the biggest challenge has been how can I talk to a doctor without going to the doctor. So we could not convince people initially. So but the biggest channel for us for the growth is word of mouth. So once someone who is like brave enough to talk to a doctor online had a conversation, and they saw that it's effective and it's solving the problem, they started telling to their parents and relatives in the villages and in their hometowns and villages. So that's the primary channel of growth for us. So because of the quality of the consultation, because of the actual problem that we are solving, we are able to penetrate to corners of the India. And yeah, but it's been a challenging ride, as in we had to find solutions for the problems that people sometimes don't tell to us also. So primarily we started as a chat based application. So we thought that it should not be a new learning experience for people. So we chose WhatsApp interface as the interface because already someone had taught people to use how to use WhatsApp. So they know how to chat. So that's how it started. And when we initially saw more people were interested to have a chat with doctor, but when we asked them, they say I want to chat with the doctor. But we saw that on call is actually when people are getting most out of their thing. They are able to ask more follow-up questions, and they are able to get attention of the doctor instantly. So we even though the user wanted chat, we saw that the call is more effective, and then we introduced call consultations and increased the volume of call consultations, which help more people. And paying online is one more problem for the people, especially tier 2 and tier 3. A lot of people did not have an experience of making an online payment as of now, still now. So but they want a solution for their health problem, and they don't have a doctor. So we saw different people, like there will be a guy in that small town who can pay online, who have a credit card, debit card, or a net banking. The people in that town will go to that guy and ask him to make the payment. And one of the customer told us, मैं आपको मोबाइल में बैलेंस ट्रांसफर कर दूंगा, why can't you make me talk to a doctor? So that's when we realized, okay, mobile recharge is something that has penetrated across India. Like there are two things that got a lot of penetration. One is cigarette, one is mobile recharge. Any corner you go, you'll find those two. So we thought if we are able to make people pay through mobile balance, we would be able to like cater to more people. And we had partnered with a lot of telecom providers then, and we were able to make people use their mobile balance as well. So we were able to reach more people because of the same. And now with Jio and Airtel, the different kinds of plan not having any mobile balance, so it has went down, and we started pay later concept by partnering with a lot of third party partners, where people can talk to doctor and then can pay to doctor after the consultation has been completed. So yeah.
Harsha, how you take care of the authenticity of the doctors as well as the patients?
So doctors, I'll first talk about doctors. Doctors, we do a three-step verification, where first there will be an interview with the in-house doctor, and then there will be one more interview with the head of medical department at DocsApp, who will assess both clinical competence and also how the doctor is receiving, or how the doctor talks and all. And the third step is the physical verification. So we partner with different agencies where they'll go to the physical location and see if doctor is there, and he like his clinic and the pharmacies around him and the people around him, talk to them to find out the actual authenticity of the doctor. And we make sure the doctor can only use the app on his phone itself. No one else will be able to use it. And yeah.
You have couple of big players as competition in the same for the same solution. So how you try and stand out?
As of now, I don't think there are any competitors in online consultation space at least. So we are now doing more than 10,000 consultations a day, paid consultations a day through our platform. And I'm not sure anyone who is doing at least 3 times or 4 times like lesser than that. So yeah, there are like hundreds of players out there who are doing like small bits and pieces of online consultation, but we hold more than 60% of the market share today.
Harsha, any learning that you want to share during your process of innovation?
Yeah, one thing I would say is customers won't tell what they want. We need to find out what they want and then give them that they need. So that's the important learning that I had in the last 4 years. So yeah.
Harsha, it was really lovely talking to you, and your innovation is really very innovative. We wish the entire team of DocsApp all the good luck.
Thank you for the opportunity. It has been great giving out the presentation at the Aegis. And yeah, the jury has been really wonderful. They had given us a couple of suggestions as well, which we are like very interested to implement as well in our solution. Yeah.
So you're taking back some food for thought for yourself.
Yeah, definitely.
Sure. We wish you come back again next year as well.
Thank you.
Thank you so much.